Okay, so I'm going to review the orders and the allergies. I'm going to gather my supplies. I'm going to knock on the door, wash my hands, pull the curtain. Hi, my name is Haley. I'll be your nurse today. Can you verify your name and date of birth? I'm going to check on the armband to make sure that I do have the right patient. I'm going to put on some gloves, and so today we're going to be inserting an NG tube. I'm going to verify the type and the purpose for the tube, which could be for suctioning or for internal feeding. I'm going to ask, have you ever had any nasal or oral surgeries before, or any gastric bypass? Okay, so if that's no, I'm going to raise the bed to the highest working position, to a good working position, put the patient in high Fuller's position. I'm going to put the towel on the patient's chest. I'm going to take the tube out of the bag, and I don't have any tape, so I'm going to be pretending. But I would have had that prepared and split off, so I'm going to measure from the tip of the nose to the tip of the ear, and then down to the xiphoid process. I'm going to put a piece of tape where my finger is so I know where to stop inserting the tube. Then I'm going to instruct the patient that they're going to have to flex their head backwards when I begin inserting. So I'm going to have you raise your hand if you want me to stop. I'm going to be inserting a little bit, and then I'm going to stop, have you drink some water, and each time you swallow, I'm going to advance the tube a little bit more. So first, I'm going to inspect the nares with a pen light to make sure that there is no, or that the nostrils are open. So I'm going to open this, I'm going to lubricate the tip. I'm going to wrap the rest of it around my index finger. I'm going to advance downwards 6 to 7 centimeters. Downwards, and then I'm going to stop, and then if you could take a sip of the water, and then each time they swallow, I'm going to advance it further until I get to the piece of tape. I'm going to make sure that I'm not letting go of the tube until I tape it down. I'll put the larger part of the tape on the nose and then wrap around the other two sides to secure the tube, so I can let go once I secure the tube. And then if there was any signs of coughing, gasping, or cyanosis, I would have immediately removed the tube. And then, are you able to talk? Okay, I'm going to examine the posterior pharynx to make sure that the tube is not coiled. So then I'm going to use the hospital policy and procedure, and I'm going to check the insertion of the tube. So I could use a 60 milliliter syringe to aspirate the gastric acid, and then if specimen was needed to test for pH, I would be able to collect that specimen, or if a chest x-ray was ordered, I would have to do this before I administer the fluids, the feeding, or the medication. So then I'm going to secure the tube to the gown to make sure that there's no tugging. And then I forgot to say this, when I was inserting the tube, I would use gentle pressure, but I would not force it. Okay, and then per order, I would administer the feeding, or if it was suctioning, I would prepare the suction cup. I would administer low intermittent suctioning, and I would leave the air vent open. And then I would keep the patient at a 30-degree angle or higher. So then for removal of the tube, I'm going to clamp the NG tube, and then if it was a feeding machine, I would turn off the feeding pump, and then I would remove the tube from the pump. If it were suctioning, I would turn off the suction machine, remove the tube from the suction machine. Then I would administer about 30 milliliters of air into the lumen of the NG tube to clean it out. And then I would remove any tape. So I'd remove the tape. I'm going to instruct you, hold your breath while I slowly take out the tube. Hold your breath. Okay, I'm going to check that the tube is still intact. I'm going to properly dispose of this, wrap it up in the towel, dispose of this. I'm going to dispose of all my supplies. I'm going to check, and then I'm going to document if there's any drainage or discharge to make sure that the tube is still intact. I would measure, or I would document the length of the tube that I used, the type of tube and the purpose for it, whether if it was for internal feeding or suctioning. And then I would put the bed in the lowest position, put their items in reach, the collar in reach, put both the side rails up, and then I would position for comfort and document my findings.